So our next topic is about medication management. So medication management, what is the importance of medication management to us caregivers? It will help us to be diligent and be keen in giving medications to our patient. As caregiver, we can be delegated as a giver of a drugs or medicine for our patients, especially if we are uh, working as a home caregiver. So the nurse will instruct to us how to give a certain medications for our patients. So we should be keen in giving medication so we will prevent medication administration errors. So first, let us define what is medications. Medications are those substances that are injected, inhaled, or used topically in the diagnosis, treatment, and prevention of diseases. Topically means yun yung mga gamot na pinapahid. Okay? So this includes drugs that we can buy with prescriptions, over-the-counter drugs, or those non-prescription drugs. Herbal medicines, so those are the medications. What is a drug? Drug is a substance that has a physiological effect when ingested or otherwise introduced into a body. Okay? So what is the difference between medicines and drugs? Okay? So what is the difference? Medicine can treat a certain type of disease. Drugs can treat also a disease. That's why marijuana is legal to other countries because it have a physiological effect. Okay? But medication is done or made for treatment of diseases. Yung drugs, pwede siyang makatreat kasi meron siyang physiological effect. But if you misuse it or you abuse it, okay, pwede kang magkaroon ng mga overdose or complications. So what are the purposes of drugs and medications? It can promote healing. It can cure diseases. Okay, promote healing. If we're giving a medications for wound, okay, antibiotics, okay, it will fasten the healing process of the wound. Cure diseases like chemotherapeutic drugs we use in cancer patients. Okay, it will cure disease. Control or slow progression of disease. Okay, what are those? Chemotherapeutic drugs. We can cite it as an example. Prevent disease. Okay, what are those medications that prevent disease? Injections like uh, immunizations, vaccines. Okay, it will prevent disease. Like BCG, it will prevent tuberculosis. DPT, it will prevent measles, diphtheria, and tetanus. So those are the vaccines. Then decrease risk of complications. Okay, what are those? Those medications that we are using for antihypertension. So if you're using medications for hypertension, okay, it will decrease the risk of complications in heart, okay, in stroke. So number 6 is increase comfort level. Okay, what are those? Those medications that decreases our pain. Okay, what are those? Ibuprofen, paracetamol, tramadol. Reduce excessive activity in the body. What are those? Those medications that we are using for seizure, convulsion. Okay, so those medications or sedatives. So what are the 10 rights of medications? Bear in mind that these rights are the rights of patients when you are giving medications to them. Okay, so please please memorize this by heart. So first is the right medication. You should give the patient the right medication. Okay, if it's paracetamol, give paracetamol. Don't give ibuprofen. Right dose. Okay, if it's 500 milligrams, give 500 milligrams, not 1000, not 250. Right time. If it's AM dose, give it AM dose. Okay, don't give it in the afternoon shift. So if it's this is the right time, because some medications it will take effect, okay, on the same time. So please give it on the right time. Right route. Okay? Right route is, anong route mo siya ginamit? Oral ba siya? Injection, inhalation, nebulization, topical ba siya? Pinahid mo siya? So those are the right route. Right patient, tama ba yung pasyente na binigyan mo? Mamaya si room 1 ang binigyan mo, dapat pala si room 2. Number 6 is right patient education. Before giving any medication, okay, you should always educate your patient. What are these medication? What are those side effects that you can expect for having these medications? For example, I will give you antihistamine, okay, cetirizine. So what you will expect of having this, for having this cetirizine, will have dizziness, pwede kang mahilo, pwede kang antukin. So those are the right patient education. Right documentation is you write it. If you give the medication, write it, document it. Okay, don't forget. Because anything which is not documented, it is not done. Always remember that. Next, right to refuse. Right to refuse, if the patient refuses to take the medication or any treatment, it's their right. But before respecting the right of the patient, make sure that you explain the patient why you need the medication. If still he refuses, okay, document it, inform your supervisor that he refused the medications. Then, right assessment. Right assessment means you assess first. You take initial data, you take initial information from the patient. Maybe the patient have uh, allergy to that medication. So first ask, do you have allergy to this medication? So if you forgot to ask this to assess the patient, maybe you will it will be risky to the patient because maybe he's allergic, then you give the medication. So maybe the patient might die, patient will have allergic reaction, and so on, so on. So make sure that you assess first before giving any medication. Then, right evaluation. Right evaluation is you evaluate if it's the effectivity of the medication. Okay, if it's for allergy, you give anti-allergy medication, the allergic reaction decrease or nothing happens. So that is the right evaluation. So we have different types of medication. We have the prescribed medication, over-the-counter herbal medications. Prescribed, ito yung mga piniprescribe or in order ng mga doktor. Then, over-the-counter, ito yung mga walang prescription na bibili natin sa mga pharmacies na walang prescription like paracetamol, like ibuprofen, cold medications. Then, herbal medications, those medications that is from herbal, which is like lagundi, like that, etc. So that those are the herbal medications. We have different routes of medication administration. It is divided into systemic and local. When we're talking about systemic, it's subdivided again into enteral and parenteral. Enteral, it consists of oral through our mouth, sublingual sa ilalim ng dila, buccal dito sa may cheeks. Why are those medications are put in that way? Because those sites have a good blood circulation. Okay, marami yung mga veins and arteries diyan, kaya mas na-absorb agad yung gamot. Parenteral, yun yung mga ini-inject na mga gamot. Okay, ini-inhale. intravenous, intramuscular, intraarterial, intraarticular, intrathecal, intradermal. Intravenous sa ugat, intramuscular sa muscle, intraarterial sa artery, intraarticular sa bone, intrathecal dito sa may spinal cord, intradermal sa dermis, sa skin, subcutaneous sa taba. Pwede yan yung mga example niyan sa mga insulins. And intracardiac is going to the heart. So those are the routes of medication. We have also local, yun yung mga pinapahid sa skin, intranasal, yung mga sa nose, and then ocular sa ears, yung mga drops. So indications, what we will mean about indications. Ang indications, in short, ang indication lang is anong purpose ng gamot. For example, cefuroxime. Cefuroxime, anong purpose nun? It is an antibiotic, antibacterial. Okay? So, pwedeng ang indications, ang purpose niya pwedeng diagnostic, okay, sa mga blood test, prophylaxis, pang-prevent ng mga certain diseases, and therapeutic, panggamot ng mga any diseases. Then, we have also side effect and we have adverse effect. Okay, dito lang tayo mag-focus sa adverse effect and side effect. So, pag sinabi nating side effect and adverse effect, anong mas malala? Ang mas malala ay ang adverse effect. Pag sinabi nating side effect, okay, in short, side effect is the expected effect of medication. It means kung ang gamot mo ay antihistamine, ang expected na magiging effect sa'yo nun, na side effect, na effects is aantukin ka. Pag sinabi mo namang adverse effects, it is the unexpected effects. Yung hindi mo expected na magkakaroon ka, like nahirapan kang huminga, hindi yun common na effect ng medication. So, mas malala ang adverse effect kaysa sa side effects. So, this is so, dito na tayo sa assessment for reaction. Okay? Usually, bago mag-effect ang mga medications for IV or intravenous sa ugat, 3 to 5 minutes bago siya mag-effect. Intramuscular sa muscles, 3 to 20 minutes. Subcutaneous, 3 to 20 minutes also. And per orem, through mouth, 30 to 45 minutes. That's why, if your patient is asking you, hindi pa nag-e-effect yung painkiller na binigay mo. Eh, wala pa namang 30 minutes, oral yung binigay mo. So, sabihin mo, maghintay lang siya ng 30 to 45 minutes para mag-effect yung medication. After that, kung wala pa rin, pwede tayong magbigay based sa order ng ating mga superior. So, dapat ang isang drug order, isang prescription, meron siyang name ng patient, meron siyang file number, date and time, legible handwriting, but it's very difficult for them kasi nga lahat sila ay kalkal, manok ang sulat. The name of the drug to be administered, dosage, frequency of the drug, method of administration, ano bang route niya, signature and stamp of the physician. Make sure pag you're having a prescription na dapat yung bilhin sa pharmacy, dapat kompleto. Dapat ito yung part niya. Dapat kompleto siya para hindi kayo pabalik-balik. So, ano yung mga dapat nating tandaan if we're giving medication? First, we should assess our patient. If your patient is having history of allergies to any medications or food or drug interaction, so we should always assess that. We should follow infection control policy before giving any medications. We should always wash hands. After giving medication, we should always wash hands. Then, patient must be correctly identified by 2 identifiers. What are those identifiers? Please use the name of the patient and the file number or hospital number which is present in the ID band of the patient. Okay? Make sure before giving any medication to prevent medication errors, okay? Please check the name of the patient and MRN or the hospital number in the ID band. Okay, don't forget. Do not identify patient using room or bed numbers. Okay, maraming nagkakamali at nag-error at nawawala ng lisensya. It's because of medication administration errors. Then, gather or review assessment data, especially vital signs. Kung nagbibigay ka ng medication na para sa pampababa ng BB, make sure na nag-take ka muna ng blood pressure before mo siya ibigay. Baka naman, mababa na ang BP ng patient mo, tapos nagbigay ka pa ng pampababa ng BP. So, ano mangyayari sa patient mo? Mahihilo, magkakaroon ng hypotension. So make sure you assess the patient first before giving any medication. Then, to the maximum extent possible, only administer medications you have personally prepared. Kung siya ay prepare ng kasama mo, ng colleagues mo, wag mo siyang ibigay sa patient. Mamaya, ibang gamot pala yon, tapos ikaw ang nag-document. So, ikaw ang magkakaroon ng medication error. Do not administer medications from containers that are unmarked or illegible. Do not give medications that have changed color or appearance and container is broken or crusted. O, dapat intact pa rin yung container niya kasi baka mamaya expired na yun. Then, always check the expiration dates. Tablets and capsules should be maintained in their wrappers and open at the bedside. With each drug, inform the patient of the drug's name, purpose. Okay, you educate the patient. Then, medication order should be written in the physician order sheet. Medication shall be double-checked by a witness during preparation and administration if it's high alert medication. Pag sinabi nating high alert medication, those medication, it can harm the patient. Okay? What are those? Yun yung mga gamot na like insulin na yung mabilis mag-effect. Kailangan mo ng witness doon kasi pag yun ay nagkamaling ibinigay sa patient, okay, mabilis mag-drop yung sugar ng patient. So, it should be with witness. Then, any order that is incomplete, illegible, yung mga order ng doktor, handwriting na hindi maintindihan, always clarify it before giving any medications to prevent error. In situations that medications is not given, not tolerated, kunyari nagsuka, sinuka lang niya, refuse, notify always the physician or the doctor or superior so they will know what to do. Do not leave medications unattended and accessible to patients. Okay? Make sure kung na-busy kayo, wag mong iwan sa station yung gamot. Make sure ilagay mo ulit sa pharmacy room. Then, pumunta ka sa ibang pasyente kung kailangan ka. Then, kunin mo ulit yung gamot at ibigay mo dun sa patient na nangangailangan. Then, remain with the patient while they take medication. Some patients, they are not taking the medications. If you leave the medications with them, they just throw it. So, make sure that they swallowed it and then they take it before going out. Okay, what are those generic names and trade names? Generic names, yun yung, for example, paracetamol and Biogesic. Ang generic name doon ay paracetamol. Ang trade names doon ay ang Biogesic. So, ang re-regulate ng production, distribution ng drugs or medications is yung FDA or ang Food and Drug Administration. So what are those medication management? Medication management is a treatment system used by doctors and pharmacists to ensure that patients are receiving optimal therapeutic outcomes for the prescription medications that they may be taking. We need medication management kasi may mga pagkakataon na ang patient na inaalagaan mo ay may 20 kinds of medications na pinapainom. 2010. So, pwede kang ma-confuse. So, as a caregiver, you should manage it. You should uh, sort it, organize it para hindi ka malito at magkaroon ng medication administration errors. So, importance of dosage and special instruction, it is important to give the exact amount that the label calls. Okay, kung sinabi ko nga 10 medication administration, okay, dapat right dose ang ibigay. It be stored kung ang gamot ay kailangang i-store sa freezer, sa ref dapat i-store niyo diyan kasi mawawala yung effectivity niya 'pag hindi mo siya ini-store do'n. So, kung anong nakalagay sa instructions, kung saan mo siya puwedeng i-store is do'n mo siya i-store. When a label says a medicine needs to be taken with food or drink, follow these directions. Okay? May mga gamot kasi na binibigay empty stomach like yung mga antacids. Hindi siya mag-e-effect 'pag meron ka ng food. Dapat empty stomach. Okay? So many pills, where do I begin? Ang daming gamot ng patient mo. Paano mo iso-sort, organize? First, you can make a medication list like this. Okay? So you have the name of the patient, the date, and then the medications. The name of the medications. Here is the frequency, the condition medication taken for, para saan, physician who prescribed the medication, and the notes. Okay, may allergies pa siya dito. So, yun yung pwede mong gawin na una. Okay? Number 2, you can organize them by using a color system labels, or you can use a pill box like this. So, meron dyan Sunday, Monday, AM, and then meron siyang PM. Make a schedule of each medication like this. You have the timing, then the day. So, pwede mo yang gawin. So, okay. Meron tayong mga common medication problems. Pag na-encounter natin yun, ano yung mga pwede nating gawin? Problems related to the name of the medication. Okay? Pag may mga medication na nagko-confuse ka, you should always ask your superior or the doctor. If there's a problem regarding the prescription, tell the doctor or nurse if cannot read what he or she writes. Kung illegible handwriting, dapat itanong mo siya. Then problems getting prescription filled, talk with your family members, doctors, or nurse. He or she may help you figure out a solution. Then problems hearing what the doctor, nurse, or pharmacist is saying, tell people you cannot hear and ask them to speak louder. Problems remembering to take medication, of course, use pill boxes, and also you can use medication list. Problems opening pill bottles or giving medications the correct way, you should always be instructed by the pharmacist, the nurse, or the doctor how to do it. Okay, so that's all about medication management. Thank you.